Hello everyone. Today we'll talk about the rules Medicare is proposing for hospital outpatient prospective payment and ambulatory surgical center payment systems for calendar year 2021. Some of the highlights of CMS 1736P that was released on August 4, 2020 are as follows. CMS proposes to eliminate the inpatient-only list over a 3-year transitional period, with the list completely phased out by calendar year 2024. They propose to begin with the removal of nearly 300 musculoskeletal related services, which would make them eligible to be paid in the hospital outpatient setting by Medicare when determined by the physician that outpatient care is appropriate, in addition to the existing ability for payment in the hospital inpatient setting when inpatient care is appropriate. Additionally, procedures removed from the inpatient-only list will eventually become subject to the 2-midnight rule used to determine eligibility for admission. CMS also proposes to continue the 2-year exemption for procedures removed from the inpatient-only list beginning in calendar year 2020 and subsequent years from certain medical review activities relating to patient status. CMS is proposing to expand ambulatory surgical center utilization by increasing the number of procedures that Medicare would pay for when performed in an ambulatory surgical center, which would ensure CMS payment policies do not favor one type of care setting over another. CMS would ask for public suggestions to nominate procedures that can be safely performed in the ambulatory surgical center setting. CMS is proposing to update the ambulatory surgical centers rates for calendar year 2021 by 2.6%. The proposed increase applies to ambulatory surgical centers that are meeting relevant quality reporting requirements. Per CMS, this increase would encourage the migration of services from the hospital setting to the ambulatory surgical center setting. In a continued attempt to focus on reducing the unnecessary increases in the volume of covered outpatient department services, CMS is proposing to require prior authorization for cervical fusion with disc removal and implanted spinal neurostimulators, beginning for dates of service on or after July 1, 2021. The calendar year 2021 outpatient prospective payment system / ambulatory surgical centers proposed rule would exclude cancer-related protein-based multi-analyte assays with algorithmic analysis from the outpatient prospective payment system packaging policy and add them to the laboratory date of service provisions at Title 42, Part 414, Section 510, Paragraph B5. In continuing CMS's efforts to reduce burden and improve efficiencies through the Patients Over Paperwork initiative, the agency is proposing to establish, update, and simplify the methodology that would be used to calculate the overall hospital quality star rating beginning with 2021. CMS is proposing changes to update and refine requirements for the hospital outpatient quality reporting and ambulatory surgical center quality reporting programs. CMS is not proposing any additions or removals of measures for either program. Here you will find references for the content of this PowerPoint presentation. If you like this video, please give me a thumbs up and subscribe to my channel. Thank you for watching. See you next time.